Welcome to the Pathology and Pharmacology module. In this module, we will explore how diseases develop and how we treat them with medications. This fascinating intersection of pathology and pharmacology helps us understand both the why of diseases and the how of treating them. Before we dive into the diseases and their treatments, let's get you familiarized with the terminology used in this module. Etiology is the underlying cause of the disease. For example, flu is caused by influenza virus. Rheumatoid arthritis is an autoimmune disease where the body produces antibodies against its own tissues. There are also many diseases where we haven't figured out the cause, and we call these idiopathic conditions. When studying diseases, we look at the signs and symptoms of the disease. Signs are objective evidences of a disease that doctors can observe or measure, like a rapid heart rate of 120 beats per minute, or a fever of 38.5 degrees Celsius, or an observation that the patient is sweating. Symptoms, on the other hand, are what patients experience, like they have pain or they are feeling dizzy. Pathophysiology is the mechanism by which a disease develops. It covers the sequence of events from the initial cause, which leads to the underlying processes, which result in the signs and symptoms. This is like mapping out the domino effect of what happens in the body once the disease starts. For instance, in type 2 diabetes, the journey might begin with cells becoming resistant to insulin. This leads to higher blood sugar levels, which then causes various complications throughout the body. Understanding this progression is crucial because it helps us to identify where we might intervene with treatments. Certain diseases may lead to complications. A complication is a new medical problem that develops because of an existing condition. So it's not part of the original disease process, but rather a secondary issue that occurs because the first disease created conditions that made it possible. For example, consider the flu. Flu is caused by a virus. When you have the flu, your respiratory tract becomes inflamed and damaged. This damage can then create an environment where bacteria can more easily grow and thrive. As a result, some flu patients develop bacterial pneumonia, which is an infection in the lungs. This bacterial pneumonia is not caused directly by the flu virus. It is a complication that occurred because the flu created favorable conditions for bacterial growth. Diseases can be acute or chronic. Acute conditions are characterized by sudden onset and short duration. Think of influenza, measles, or the common cold. These conditions develop rapidly, often within hours or days. Then, patients also recover quickly from these conditions. Chronic conditions, in contrast, develop insidiously, meaning slowly and gradually, and persist long term. For example, diabetes and osteoarthritis. These conditions often progress so gradually that patients might not even notice any symptoms until the disease is well established. This is why regular health screening is particularly important for chronic conditions. To detect diseases, we use screening and diagnostic tests. Let's start with screening tests. Screening tests are performed on people who appear healthy with no obvious symptoms. The goal is to catch potential problems early before they become serious or even before any symptoms appear. Some common examples include mammograms for breast cancer screening, pap smear for cervical cancer, blood pressure checks, cholesterol screening, and diabetes screening through blood sugar tests. Now let's switch to diagnostic tests. These are different. When someone has symptoms or when screening tests suggest that something might be wrong, we use diagnostic tests to figure out exactly what's happening. Diagnostic tests can fall into several categories. Lab tests, such as blood tests, urine analysis, or culture samples. Imaging techniques such as X-ray, CT scan, MRI, ultrasound or nuclear medicine. Biopsy, and this is where we take a small sample of tissue to examine under a microscope. This is often considered the gold standard for diagnosing many conditions, especially cancers. Here's a practical example to tie all of this together. Let's say during a routine mammogram screening, something suspicious is found. The doctor would then order diagnostic tests, perhaps a biopsy, to determine whether that suspicious area is in fact cancerous. Now let's look at the pharmacology side, which is on how medicines work. First, let's break pharmacology into its two fundamental components. Pharmacodynamics. This is what the drug does to the body. Think of the drug acting on its receptor like a key fitting into a lock. How does the medicine create its effect? Where does it act in the body? What changes does it cause? For example, when you take a pain reliever, pharmacodynamics explains how it blocks pain signals in your body. Pharmacokinetics. This is what the body does to the drug. So things like how does the drug get absorbed? Where does it travel in the body? And how is it broken down? How is it then eliminated from the body? So using our pain reliever example, pharmacokinetics explains how it gets from your stomach into your bloodstream, how long it stays active, and how it's eventually eliminated. Pharmacology is studied in two different but complementary ways. Basic pharmacology is about studying how drugs work at a molecular level. It looks at cells and their responses to the drug. For instance, how a drug binds to specific receptors and what effect it has on the cell. Clinical pharmacology looks at how drugs actually perform in real patients. How do drugs work in actual people? What happens when patients take multiple medications? And how do factors like age, weight, or kidney function affect drug action? What side effects might occur? So bringing it together with an example, basic pharmacology might discover how a new blood pressure medication works at the cellular level. Clinical pharmacology then determines how to use it safely in patients, what dose to give, what other medications might interact with it, and who should not take it. There are thousands of drugs, and drugs can be classified in many ways. By their therapeutic use, for example, antihypertensives, antibiotics, and anti-migraine medicines. They can be classified by their chemical structure, so based on the structure like phenothiazines, steroids, tricyclics, or tetracyclines, or by their mode of action. For example, some drugs act on enzymes, some act on receptors, some act on ion channels, etc. In this module, we have generally classified them by their therapeutic use. So, what will you learn in this module? Let's start with drug names. Every medication has two names. The generic name, think of this as the drug's official name like paracetamol. And the trade name, this is the brand name like Panadol. Indications or uses, this tells us what the drug is used for, its approved purposes. For example, paracetamol is indicated for pain and fever. Mechanism of action, this is how the drug actually works. For example, does it block certain receptors or enzymes? Side effects or adverse effects. No drug is perfect. They all come with potential unwanted effects. We need to understand the potential risks in order to better manage them. Contraindications. These are the situations where the drug should not be used. For instance, some drugs cannot be used in pregnancy or certain medical conditions. Drug-drug interactions. When two or more medications affect each other, they might either increase or decrease each other's effects or cause new side effects. Some medications also don't mix well with certain foods. For example, grapefruit juice can affect many medications. And some drugs also need to be taken with food, while others need to be taken on an empty stomach. Special precautions, these are the extra considerations that we need to keep in mind. For example, some drugs require dose adjustments for kidney or liver problems. Some drugs have special monitoring requirements or certain storage requirements. So why does this all matter? Understanding all of these aspects helps us to choose the right drug for the right patient, and this helps us to ensure optimal outcomes and reduce side effects. It also helps us to educate patients effectively. By studying pathology and pharmacology together, we get a much clearer picture of both the disease process and how we can intervene effectively. By understanding the underlying mechanisms of the disease, we also understand how drugs can target those processes to exert their effects.